Alcohol-dependent syndrome is previously known as alcoholism. It is a pattern of pathological use of alcohol beverages since at least a month that will damage the social and physiological or both, and it will damage the social and occupational function.
Okay. Complications of alcoholism. Take that.
Liver cirrhosis, neurological neuropathy, cardiovascular hypertension, cardiomyopathy, mental health, depression, anxiety, suicidal thought, cancer, liver, throat and mouth, pancreatitis, acute chronic inflammation.
Etiology.
Genetic, social, progression, psychological and environmental.
Can you explain something about social?
Social stress from the unemployment and work stress, peer groups.
Group pressure. Okay. Anything else from social point of view? No.
Society should not drink and should not harm others.
Anything else? From financial point of view?
They will not be able to save money for their future.
Good.
If they got money, they will be able to
Okay, good. Anything else? What are the treatment options available? Jamila? Who's the case? Case questionnaire? Treatment options. Disulfiram? Okay, anything else? Any other treatment options? Behavioral therapy, very good. Anything else? Counseling, very good. Occupational therapy, of course, if they have any occupational issues, we can give them occupational therapy to redefine their occupation. Okay? Anything else, Prabakar? Psychological support to the patient and the family, very important. If you don't support them and the family, sometimes what they will do is those families will reject the people and they will send them into the street. Okay, so that will not help the individual. That will make the individual to go into alcoholism even more because they will not be having any control. Okay, so that's why when we are treating a patient, we have to see them as a whole. It's not that just the patient. We need to treat the patient and the family as well. Just to say that how they have to support the individual to recover from the problem that they have. We should not create more problem. Okay, this is what is the treatment is. Okay. In India, alcoholism is emerging as a bigger problem nowadays. As you can see in the media, there are a lot of the things are coming out saying that alcoholism is becoming a bigger problem now. As medical professionals, it is our job to educate the patient and the patient family and ourselves that what are the problems will occur, what will be the social impact during or when you have alcoholism. Okay, there are so many alcoholic patients who are not fit for society at many times. Okay, you could have seen them on all the social medias. They go fight and all this. Okay, from psychiatric point of view, alcoholism, when it leads to alcoholism as a syndrome, what they do is they go into the state that they cannot live without alcoholism. They will be craving for alcoholism all the time. So what we need to do is to bring them out from the cravings. What we are going to take them to the programs like Alcoholic Anonymous program. Have you heard about that? So it is like a self-help group. So people who are recovered from alcoholism, they come to the hospital or a nursing home. They teach the new alcoholics or the new alcoholic patients about how to recover from alcoholism. And there are medical treatments, as as we said, disulfiram is there, and very important that most of the alcoholic patients, when they stop alcoholism, within 48 hours they will start to do withdrawals. We see alcoholic withdrawal patients, they will have, because of their minerals and vitamins deficiency, they start to do withdrawals, like they will be doing like this. If you give them a pen in their hand, they will be doing like that. So this is part of their manifestations of clinical withdrawal syndrome. Okay, some of them might go into hepatic comas. Have you heard about it, hepatic coma? Hepatic coma means because of their liver is not functioning, the liver, all the liver enzymes and everything, all the liver chemicals will release, that will go into the blood stream, that will make them go into hepatic encephalopathy. Okay, they literally go into hepatic coma, hepatic encephalopathy. So in this case, what we need to do is we need to treat the symptoms first, as well as alcoholism. Okay, the first line of treatment would be to give them, replace them with all the vitamins to start with. That's what you see them having a drip with the yellow color fluid. Have you all seen them? So that is our vitamins they have. Okay, the vitamin is the one which is going to stop them withdrawing. Okay, once the withdrawal is sorted out, then we will go into the next level of treatment. They will be, most of the time, they will be malnourished. So we have to give them a proper diet. Okay, so that is what is the treatment is.